Toothache is one of the few things that connects every human being who has ever existed. It doesn't matter the century. It doesn't matter the continent. That sharp, specific pain, impossible to ignore, and has been around long before there was even a single word to describe it. Most people assume dental care is a fairly recent invention, something that starts with the white-coated dentist and the reclining chair. The truth is much older and much more uncomfortable. In 2017, anthropologist David Freyer at the University of Kansas published an analysis of a Neanderthal molar found at the Krapina site. In Croatia, roughly 130,000 years old, the tooth showed marks of deliberate manipulation, scratches and wear consistent with the repeated use of a pointed object, likely to relieve pain from an inflamed or infected area. This wasn't random. It was a repeated pattern, consistent with someone trying to calm a pain that wouldn't go away. A Neanderthal, hundreds of thousands of years before writing existed, was already trying to treat his own dental pain. Let's move forward in time, but not by much in evolutionary terms. In 2012, a team of researchers published an analysis in the journal PLOS One of a tooth found in Slovenia, roughly 6,500 years old. Inside a crack in the enamel, they found traces of beeswax. It wasn't accidental. The wax had been deliberately placed inside the cavity, in the exact spot where the tooth was most weakened. It is, to date, the oldest documented dental filling in the archaeological record. Thousands of years before any modern concept of dentistry existed, someone had already figured out something fundamental. If you seal the hole, the pain gets better. In 2015, a study published in Scientific Reports, led by Stefano Benazzi, analyzed a tooth roughly 14,000 years old, found at Reparo Fredian in Italy. The analysis revealed scraping and drilling marks inside the cavity, consistent with the use of tiny flint tools. Someone, 14,000 years ago, had deliberately drilled into a human tooth to remove damaged tissue. It is essentially the direct ancestor of the modern dental drill. The twist nobody expects. Here's where the story gets genuinely interesting, because the logical assumption would be that the further back in time we go, the worse our ancestors' teeth must have been. The data says the exact opposite. Multiple bioarchaeological studies comparing skeletal remains from before and after the agricultural revolution, roughly 10,000 years ago, show a consistent pattern. Hunter-gatherers had significantly fewer cavities than early farmers. Anthropologists like Clark Spencer Larson have documented this shift across different populations around the world. The reason is simple. A diet based on meat, roots, and wild vegetables doesn't feed the bacteria that cause cavities nearly as well as a diet based on grain and processed starch. In other words, the exact moment humanity started cultivating wheat and barley on a massive scale was, literally, the moment our teeth started getting seriously worse. In ancient Egypt, around 2600 BC, there lived a man named Hezi-Ra. His tomb describes him as chief of dentists and physicians, the oldest known title specifically referring to dentistry as a profession. Centuries later, in Mesopotamia, the Sumerians had their own explanation for cavities. They believed a tiny worm lived inside the tooth, gnawing away from within. This idea, the tooth worm, survived as a medical explanation for thousands of years, well into the 18th century in Europe. It wasn't until 1728 that French surgeon Pierre Fauchard published the Chirurgien Dentiste, the first systematic treatise on modern dentistry, laying the foundations of the discipline as we know it today. And it wasn't until 1844 that a dentist named Horace Wells publicly demonstrated the use of nitrous oxide as dental anesthesia, the first time in human history someone could get a tooth fixed without feeling the full force of the pain. Think about it this way. For roughly 99.9% of the history of our species and of the human species that came before us, there wasn't a single way to treat dental pain without feeling all of it. That Neanderthal and Krapina, 130,000 years ago, felt exactly the same kind of sharp pain you would feel today if a tooth got infected. The pain was never the difference. The pain was always identical. The difference is that he had absolutely nothing he could do about it, except grab a pointed object and desperately try to relieve it himself. We are, quite literally, the first generation in hundreds of thousands of years who can eliminate that pain completely, in minutes, feeling almost nothing at all. Next time you dread going to the dentist, remember there's a Neanderthal, 130,000 years ago, who would have given anything for your 4 p.m. appointment.